Hello everyone. Now I'll be discussing questions of diabetes. Question number 1. We have a 44-year-old lady and she is hypertensive 7 months ago and she's taking chlorothiazide, and her mother and maternal uncle have type 2 diabetes. She also have a 20 pack year of smoking. Her BMI is on the higher side and even BP is slightly on the higher side. Well, which of the following is the most appropriate next step in the management of this patient? The answer to this question is fasting blood glucose. Why this answer? Because diabetic patients have increased risk of cardiovascular events, renal disease, and blindness. The three big problems. We know very well diabetic patients are prone to CVA, including CAD also, including renal disease and blindness. Now, NICE guidelines recommend screening for all the patients above the age of 45 years, as well as those of any age. Now, our patient is of 44 years. With additional risk factor for diabetes, the risk factor are she is hypertensive, 20 pack year of smoking, which is a very important predisposing factor for coronary artery disease. Mother and uncle have type 2 diabetes and the BMI is again on the higher side. All these are the additional risk factor what this patient has for coronary artery disease. So, as I told you that this patient has multiple risk factor, hypertension right now 150/96, overweight, BMI is 28.3, family history is strongly positive, mother and maternal uncle are suffering. She should be offered screening for diabetes. This is the reason why she should be screened for diabetes. Now, what are the recommended tests that are advised? What you will advise? Fasting blood sugar, also called fasting plasma, or 2-hour glucose tolerance test, or hemoglobin, so-called HbA1c. This is the most commonly thing that is advised, but other things can be done depending on the situation. But the best initial test, screening test, is always fasting blood sugar. Okay, and we know very well if the fasting blood sugar is more than the recommended values, then it is a case of diabetes. Now let us see what are the diagnostic criteria of diabetes. Okay, so I mentioned that we go for 3 tests. One is fasting sugar, other is HbA1c, or you go for 2-hour 75 gram glucose. So the test values are as follows. Fasting blood sugar below 5.5 millimole per liter is normal, and above 7 is diabetes. And impaired glucose tolerance test, it between 5.5 and 6.9. Second is 2 hours after 75 gram of glucose, less than 7.7, more than 11.10. This is diabetes. But if it is in between, then we call it to be pre-diabetic. HbA1c less than 5.7 and more than 6.5. More than 6.5 is diabetes, and if the values are in between the two, that is between 5.7 to 6.4, we call as impaired glucose tolerance, so-called pre-diabetes, the word that we use in such patients. Okay, so we are clear about it, how we are going to diagnose a case of diabetes. Now let's look into other options. Option A, chest X-ray to rule out lung cancer. This patient is as moderately risk factor for developing lung cancer due to tobacco use. The patient is using 20 pack year of cigarettes, smoking. So the patient is in risk of lung cancer. Now, one more thing, there is no use of screening for lung cancer by chest X-ray. One thing that you got to know, we never use chest X-ray for lung cancer screening. If you have to go, for low dose CT scan is the ideal investigation to test for the lung cancer. So chest X-ray no use at all. Similarly, sputum cytology is of no use. There's no point, because these things get positive only in the advanced stage of lung cancer, not for screening. So the most important line is screening test is annual low dose CT scan is the ideal investigation to check for as a screening test for lung cancer. Okay. What about option C? It's again incorrect. Human papilloma virus vaccine. It's approved for use in all males and female patients of age 9 to 26 years. Young patient. This can cause cervical and other cancer, including cancer of the vulva, vagina, penis, and anus also. Point to be noted that not only it causes a female genital tract cancer, it also can predispose to male genitalia and including anus also. That's why this vaccine is approved for the young people in the age of 9 to 26 years. Our patient is the age of 44 years. It can also cause cancer in the back of throat, including base of tongue and tonsil. So it can also lead to oropharyngeal cancer, but the ideal age to give is 9 to 26 years. Anyway, it's again a type of preventive vaccine, so it is not going to have a direct effect on the patient screening. Well, option D is incorrect. Pap test is procedure in which a small brush or spatula is used to gently remove cell from the cervix so that we can check microscopic cervical cancer or cell changes. So primarily we do this test for cervical cancer. So definitely this you will be doing only in female patients, especially in the elderly person. Like our patient is a 44-year lady, we can try in this patient, but definitely it's only a screening test for cervical cancer. It has nothing to do with diabetes. So this answer is not correct. Well, women with average risk for cervical cancer, Pap test is recommended for every 3 years from age of 21 to 29 years. Okay, between 30 to 65 years, the initial negative test may have either Pap test alone every 3 years or combination of Pap test with HPV testing every 5 years. This is a preferred investigation. But one thing is very clear: is investigation done only for the ladies. Of course, in different age group, 21 to 29 and above 30, above 30 we can go for 2 tests together, but only for ladies. But again, it's a screening test for a cervical cancer, nothing to do with diabetes. Well, how we do the Pap test? Simple diagram, photo. You can see in the vagina they are putting a speculum and they are putting a brush to do the Pap test. I thought I must tell you how this test is done. Lovely photograph, you will understand. Well, option E, pneumococcal vaccine, is again an incorrect answer. 13-valent pneumococcal conjugate vaccine, what we call as PCV13, is recommended for all adults of age 65 or above, followed by 23-valent pneumococcal polysaccharide vaccine 6 to 12 months later. Point to be noted, this vaccine is recommended for above the age of 65 years for all the people. Well, our patient is of 44 years, so that doesn't fit into this category. Moreover, it has nothing to do with diabetes. Sequential PC13 and PPSP23 are also recommended for adults below 65 years who are current smoker or have certain chronic medical condition including heart or lung disease, diabetes or chronic liver disease. Well, so now this fit into category that our patient who is a smoker, diabetic, hypertensive can be given. But point to be noted, if these diseases are not there, then this vaccine should be given above the age of 65 years. But in our case, the patient has chronic disease, so we should give. But again, it has nothing to do with diabetes. It's more of a preventive vaccine. So, golden line to remember: diabetic risk factor in adult with BMI more than 25 kg are all patients of age more than 45 years. They are at risk for diabetes. Screening should be done. First degree relative with diabetes, high risk race or ethnicity like African American, Latino, Native American, Asian or Pacific Islanders, women whose children birth weight is more than 9 pounds. History of gestational diabetes, hypertension or prior cardiovascular disease, dyslipidemia, low HDL and high triglyceride levels, history of polycystic ovarian syndrome, history of glucose intolerance. All these are the indication that patients should be screened for diabetes. Now come the gold medal questions. Out of all these, so many risk factors, 9 risk factors I have given to you. Which of the following is the most important in the screening test? Write down the answer in your copy. Which is the most important? You can stop the video. Yes. The right answer is hypertension. The single most important that any patient of hypertension come to you, you should always screen for diabetes also, because diabetes and hypertension, they often go together. So more golden line to remember. Screening option include fasting plasma glucose, what at times they call as fasting blood sugar also, but it is when we say blood sugar, it's plasma sugar. 2-hour oral glucose tolerance test and HbA1c. They are the 3 screening tests that we do in the case of diabetes. If we suspect somebody to diabetes, these are screening tests. Thank you very much.